Electrical signals within the body assist the heart to contract and expand, translating to pumping blood at a rate of 72 times per minute. However, the heart rate could drop as low as 20 times per minute, a condition referred to as a heart block.
In Kenya, I found it is very frequently in patients with hypertension, with high blood pressure. And the problem is that when you don't treat it and the heart has only a heartbeat of 30, then the heart gets weaker and weaker, and finally you will die from sudden cardiac death or from heart failure.
Commonly found among those above 65 years and patients who have undergone heart surgeries, majority of Kenyans will dismiss the condition for aging. First degree of a heart block has no signs, with dizziness, fainting, short of breath during physical activity, and rare chest pains presenting at second degree.
So it only becomes clear when this patient starts falling. You know, the patient was okay, then all of a sudden he has collapsed, or he's getting dizzy, he falls.
The only remedy for the heart condition is insertion of a heart pacer that raises the heart activity.
A pacemaker, it's a generator which is normally inserted just below the skin, but then it's able to interrogate and is able to interact the heart to improve the patient's heart rate.
In the last 5 years, over 150 patients have benefited from a project run by German and Kenyan cardiologists at the KENYATTA National Hospital.
Several pacemaker companies, and they all very generously agreed, and so we have the chance to implant up to 40 pacemakers every year for patients who cannot afford this treatment and who after the operation are strikingly better than before.
79-year-old Josephine Wamboi is a retired nurse and has just left the theatre after undergoing a second pacemaker insertion. Her first pacemaker battery life expired 9 months ago and she could barely walk, keeping her off from any work.
Kuna kazi ya usafi wa nyumba, nikarudi nyuma kwa maana kazi nyingi singeweza.
I brought her here very early, just before 7. But I remember as we went up, she couldn't walk. She had problems breathing.
Though the insertion process lasts for less than 1 hour, it cost up to 500,000 shillings.
So as far as I know, this should be around 500,000 shilling. So this is, of course, absolutely out of the possibility of many Kenyans. The fee for hospital can be different, but even for some patients, the traffic fare is a problem.
Yes, unfortunately, up to now, cardiac disease is still, for a long time, is still not considered as part of our biggest problem in this country.
Josephine has only parted with 20,000 shillings for the procedure. However, majority of Kenyans living with this condition go unnoticed due to lack of adequate machines to test for the condition at health facilities. The pacemaker project is carried out annually, and for this year, it comes to an end on Wednesday. The doctors hope to conduct it more frequently since the numbers of people requiring pacemakers has grown bigger within the interior parts of the country. Henry Minor, GBS News.
You're right.